Hi, it's Dr. Rivkin, and I wanted to talk about a concern that patients were raising recently, and I think it's been in the news a little bit, and I think it's something that's important to address. What we've been hearing is people concerned about blindness after under-eye injections. What I'm aware of is that there's been an article that was talking about blindness after nose injections, but in any case, blindness is a rare complication of facial filler injections. So overall, this is an extremely rare complication. And the way I talk about this with my patients is that the frequency of blindness is something like a plane crash. It's very, very rare. It's similar to when, if you're flying in a plane, you want to make sure that that pilot is really well trained and very experienced and knows what they're doing. It's the same thing with your face. When you're getting filler injections done, you want to make sure that the person at the other end of that syringe is well trained, is very experienced, knows exactly what they're doing, and understands how to provide these kinds of treatments in a safe and effective manner. Every year in Los Angeles, hundreds of thousands of patients get treated with facial fillers, year after year after year. So millions of patients have been treated in LA alone. What we do is minimize the risk in our clinic by making sure to follow very specific safety protocols. And we have a lot of experience in doing this because all we do is non-surgical cosmetic procedures. So we do injections and lasers all day long. We don't do surgery, we don't do general dermatology, we don't do anything else. We focus on this kind of thing exclusively. We've really honed our safety protocols down to where they're optimized as much as possible. Avoid blindness. How do you avoid these kinds of complications that we're so concerned about? Blindness, necrosis, and these kinds of things. These are serious complications that we never want to see. For injectors, I would suggest, number one, being gentle. Anytime you're injecting, don't push hard on the plunger. Be gentle, be slow, take your time. People that are in a hurry, that's when things go wrong. So take your time. I'm always moving the needle as I inject. So I don't inject in one place because you never know when you're under the skin where that tip of the needle is. So I'm always moving the needle so that minimizes the chances of something going wrong. I use as small a needle as possible so that as little product as possible is coming out with each injection. The areas that are higher risk versus less risky, right? So the highest risk area, according to studies, is right here in the glabella. So when you're doing these lines, if you're going to use filler on these glabellar lines, you have to be super, super careful. You have to constantly move the needle. You have to be very gentle in your technique. You have to be very slow. And you have to be also superficial because the vessels lie fairly deep, and so you have to just do a little bit of superficial injections and that's it. Another area where another area that's higher risk, relatively speaking, is around the nose. This is an area that's specialty for me, and I've done thousands and thousands of these of noses, and so I know how to do it very safely, and I know how to really, really minimize the risk. So if you're going to have noses, if you're going to inject the nose, you really want to be experienced with it. You really want to know what you're doing because this is a high-risk area. What else are high-risk areas? The nasolabial folds can be a higher risk, a somewhat higher risk area for necrosis or ischemia. So again, this is an area where you have to know what depth to inject, and for the nasolabial folds, it's deeper is better, and also just be careful in terms of how you inject. You have to take universal safety precautions when you're injecting because you don't really know where the tip of that needle is underneath the skin. You need to, of course, have knowledge of the anatomy, and you need to know where structures are generally, but every patient is different. There's variations in anatomy, so you have to have universal safety precautions where you inject in a way that maximizes safety, that optimizes a safe technique. Similarly to how we know that the airplanes minimize the risk of crashing and we still enjoy flying, this should not keep you from coming in and getting the cosmetic injectables that you want to get. It's just you have to make sure that the person who's administering those injectables is experienced and is skilled and knows how to provide those injectables in a safe manner. Okay? Thank you very much.